Hi everyone, I'm Dr. Soumya Dwivedi, the Chief Radiologist and Director of Cura Diagnostics and Research Center, and it's my immense pleasure to come back and talk to you yet again another month in Cura Talks. And today, on special demand, I'm going to cover mental health impact after COVID-19 on all the generations which we're seeing, young, children, and working women, housewives, everyone involved and affected by COVID-19 pandemic, but not only physically, mentally as well. And for that, we have a great faculty with us, and I'm going to invite her right in. There was some technical glitch that can join us. So till she's joining, let me just introduce her. Dr. Shreya Pava is a PhD founder of Manasthiti, a mental health initiative. She's a trained psychiatrist, psychologist, and has been involved intensively in individual counseling for adolescents and adults and parents since many years. Thank you, Dr. Shreya, for joining us.
Thank you.
I was just apologizing to the audience that we couldn't connect. These last minute glitches are always a hassle. But now that she's here, let me tell you, her list of achievements is endless. She is also associated with Defense Research and Development Organization, which is India's premier organization of central government, and involved in projects imparting intervention programs for army personnel and their families, specifically related to mindfulness-based cognitive therapy. And she's been running many such workshops and programs in many schools and colleges and helping so many children all over India and even abroad. So thank you so much, Dr. Shreya. We are very lucky to have you and discuss today a very close topic to my heart, because I think this is a topic which is not discussed by many, especially in the Indian scenario. That is how the mental health has been impacting the Indian citizens, after the COVID-19 pandemic. Worldwide, it was a different scenario, but in India, when COVID-19 pandemic hit us, everyone was unprepared totally, and only physically everyone was worried that they should be okay, but no one thought that how it's going to have a long-term effect on all of us. And like I was telling my audiences, that every month we do conduct a poll, and we try to gather as many questions as possible from our audience, and we have sorted a few questions for you and me, and we're going to answer them as well, and we're open to some new live questions as well. So I think without wasting time, Shreya, should we start?
Yeah, absolutely. And thank you for this collab. It's really, and it's, as you said, that it's close to your heart, and it's obviously, being my profession, it's closest to my heart also. And it's very important to spread this awareness, and I thank you for organizing this. It would be very helpful. I hope so.
Thank you. It's indeed our pleasure. So, Dr. Shreya, the first question, which was very commonly asked in our poll, was, what is this mental health that we're talking about today? After COVID-19, what do we really mean by mental health impact? What are we talking about?
Okay. So see, as you said that, what is mental health? So it is one of the most important things to first understand exactly what is mental health. And I will actually explain it in the terms of the World Health Organization, the definition which has been given by that.
Okay.
So mental health basically means that it is a state of well-being. And state of well-being where the individual realizes his or her own abilities. And also you are able to cope with the normal stresses of life.
Correct.
Importantly, another aspect here is that you are able to work productively and contribute to the community. So if you see, there are 4 aspects here which we are covering. That the individual realizes his or her own capabilities, the person is able to cope with the stress. Thirdly, that the person is able to work productively, and fourth, contribute towards the community. And here I would like to specify, because most of the people have a myth here that it is absence of any kind of a disorder.
Correct.
Then, like, if I do not have depression, or if I do not have OCD or something like that, then I am mentally healthy, which is not the case.
Correct.
The case is it does not mean, mental health does not mean that there is an absence of any kind of a disorder.
Correct.
So the most important factor here is that you are able to cope with the stresses of life. And if you see, the COVID brought in a lot of challenges, any kind of challenges, economical, financial, social, so many domestic, so many things. How the people, if you see this according to this definition, how people were able to cope with those stressors, how they were able to accept those changes and still move on and work productively and work towards the community as well. So the definition of mental health stands true in everything, in that situation and in this situation, right? So that is what is mental health. And it is not at all as we consider that it is an absence of a disorder, or if you have anxiety, then you are not mentally healthy. It does not mean absolutely that. And obviously, mental health, a state of well-being is different also for every different individual. It would be different because you have biological aspects, you have social aspects, environmental aspects, and you have the psychological, the person, how the person is thinking. So it would be different for different people. So that is, I guess, in this scenario, if we see, you still have to see after the COVID, when the virus is still used to stay.
Correct.
So how people are coping with it.
So like Dr. Shreya said, it's not only one thing. It's not only an absence of disorder, but it's the overall, balance of all these four aspects which she's mentioned. And the journey of mental health wellness starts from where you are recognizing that you are, getting impacted by this. So I think Dr. Shreya is going to talk more on this. So Shreya, just
before
tell us
I move.
Yeah.
Before we move further, I would like to ask you, because I am talking about mental health. So I would like to ask you, how has this COVID affected the general physical health of the people? I would really like to ask.
That's a very important question because everyone we know now that what symptoms COVID-19 brought to us. It was generally everyone diagnosed it with a normal cough cold. So we need to understand one basic thing, that COVID-19 is also a virus like a flu. Okay, so it happened like a flu, and everyone eventually got to know. There were some theories regarding getting hospitalized on this basis, on the city value, but physically long term COVID-19 has affected us in many forms depending on what kind of population we're dealing with. Like in children, there was a suspicion, there was a myth that it's going to be very severe forms and everyone's going to be hospitalized, which didn't happen. Why? The only reason being that they already got immunity by the vaccination program which the Indian government follows, the Indian Health Ministry follows. So they had a good immunity to fight. So the person who fought with a good immunity, their body fought with a good immunity, they survived this virus well. And people who had already pre-existing illnesses like cancer patients or diabetics or heart patients, they had a struggle to face through. Many got hospitalized and we've lost many people as well. So physically, it has challenged, especially for women. Since I talk a lot about women health, women has faced a lot of challenges, especially women who are pregnant, because they didn't have a clue during the pandemic they should produce babies or not. Because that's
on the contrary, I guess a lot of people have produced.
Yeah, and then opposite happened in India, because this is India. And we did see a spike of rise in population. And let me tell you that fertility, fine. Fertility, there was no disturbance. There's no such fact anymore that COVID-19 has disturbed the fertility of the Indian women. But in long term, the babies produced after the person has gotten a vaccination or a COVID-19 infection during the pregnancy has given fighter babies, COVID babies, that they have got stronger immunity. So it's in turn, given us a more healthier population to fight this virus. So one plus side to that, but many negative also, that especially people who are facing, like already had tuberculosis or lung cancers or were chronic smokers, when they got COVID-19, still many are suffering from long-term side effects. So physically, it's deranged just from person to person, depending what kind of, physical fitness level you had. So yeah, that's that. So Shreya, after COVID-19, do you think children and adolescents are also affected? Because we always talk about, all right, so much emotional trauma, so much financial trauma the parents are facing or the families are facing, but no one really addressed about the children. They were sitting at home, not going to
Yeah.
school. Everyone thought it's the lucky day that they are
I
off
think
from
ask the
school.
children. They
So
hate
I
it.
think since you're the
Oh God.
expert, you're the right person to answer. Do you think that the studies, do their studies suggest that the children and the adolescent population have been affected mentally after this pandemic?
Yes, yes, absolutely. They have been. See, mental health is something which is very important, specifically with children, because of their emotional and the social well-being. And
Correct.
now, in the pandemic, what happened was that they were socially isolated. There was so much of uncertainty. There was so much of fear. Then I guess it also depended upon the family to family, because
Hmm.
some parents, they really exaggerated it, and it was like, of course, not being that, they also were under a lot of stress
Yeah.
and uncertainty. They
And
also had. So how you are processing the entire thing, so they also had their own anxieties, which actually kind of rubbed off on the kids. And I realized that so many kids, after the first phase of the COVID, of the
hmm.
wave, they did not want to come out. They said, "नहीं नहीं हमको बाहर जाएंगे हमें COVID हो जाएगा." It was something
Correct.
like that. The fear was so much instilled, specifically in the
Yes.
toddlers, if you see,
Correct.
and so
Correct.
the children till the age of 5, where there was not very. But
Correct.
of course, it totally depends upon the family how it is taking. But then so many children also lost either one of their parent, or something like that. So grief,
Yes.
fear. Then there is another thing which I really found, which increased tremendously during this time, was the increase in the screen time. Now they were socially
Yeah.
isolated. So one is they lost the opportunity to
Hmm.
be with their friends physically. So
Correct.
because of that, they were, even if they had to talk to a friend, they had to be, on,
Yeah.
it had to be
Real time.
online. Then,
Yeah.
yeah, and then they could not go out to play. So they were
Yeah.
again, on screen. So the increased screen time. Then
Hmm.
paternal fatigue was also one of the major causes, like in not causes, I would say a contributor to everything which was the chaos which was happening. So
Correct.
a lot of children had the fear and the anxieties. So kind of it really affected. And what I've seen specifically in the adolescents was
Hmm.
that those who were vulnerable
Hmm.
to depression or anxiety,
Yeah.
COVID played a very big trigger for them, because it came out full blown after that. OCD, anxiety, depression, these things came out, and then the worst was that their routines were haywire. They
Yeah.
were there was binge watching. You see the amount of social media
Yeah.
active the people became during that time. The binge watching which was happening on the Netflix, all these things, they all increased tremendously, which
Hmm.
added to procrastination. Then further, I saw, I had so many cases where the children were studying and doing something, and because of this thing, they just couldn't handle the changes,
Hmm.
and that's how they just lagged behind in their studies, and then they just dropped out of grade
Hmm.
12th, or had to change their subjects because they were not able to cope, because they were just watching and being on the screen. I mean, there were so many things. And then of course, as I said, that anxiety and depression, these all also played a very big role during those times, and it
Correct.
has affected children
Correct.
and the adolescents.
That's so true. My daughter was only a year old, my younger one, and she got the concept of wearing a mask and going out because she was so scared. We didn't tell her, but she was so
Hmm.
scared seeing around everything. So not only the
Hmm.
children could speak, but the ones who could not speak also were
Yeah.
up and ready for fighting this COVID. But many could not, like you said, many did suffer from depression later. Also, a very
Hmm.
important point which you picked up, and I want to emphasize little more, is the paternal, exhaustion, because the
Hmm.
paternal exhaustion in turn resulted on the children. And
Children, right.
yeah, and can you just highlight some more points on that? Because I feel some cope up mechanisms, after that, some, or if you talk on a good note, many joint families did get a little more advantage if we talk about the
Yeah,
scenario. Yeah,
absolutely. Because if there was a good social support system, which I would, which I thought I would be always be covering it up, because see, then when the parents, supposedly both the parents are working, so they
yeah,
have the, work overload of that. So
correct.
working at home and with the kids there, and then juggling between all these things, the work and other things.
And no
So
help,
it
probably
definitely,
many,
and no
no
help.
help.
Yeah, the domestic help is India's
Yeah,
biggest thing, and I think
yeah,
the most women were affected by that.
yes,
So
yes,
obviously all this, uh, it impacted the irritabilities of the parents, and everything also heightened. But the
mm,
ones who were in the joint family, they had the grandparents to, look after. And I saw in my own daughter's class,
mm,
mostly the kids were with the grandparents. The grandmothers were helping the kids in their classwork, they were sitting with them. So
yeah,
it definitely had a lot of impact if you are in a joint family. So
yeah,
that social support, that emotional support, that physical support, that domestic support is huge in
yes.
that. So the family was very important even at that point of time. But on the other note,
Mm,
sometimes where the responsibilities are not shared, when they become overburdened, then
yes.
the mother, or the women of the house, they become overburdened. It also led to a lot of problems and chaos in the families. So
So do you
it is
think
either
that
ways how.
so do you think that once, now that the pandemic is lightening up, it's still there. I will
Hmm,
not say it's gone.
hmm,
It's lightening up.
yeah.
So do you think once now that the students have started going back to school, do you think there's a
Hmm.
certain characteristic which needs to be highlighted that they've been facing this challenge when they go to school? Is it the focus, or do you think their mental capability of learning has been gone down, or is there some study which suggested that we should highlight, we should make our
Uh,
parents vigilant that they should focus on this, that
So see, yeah, of course, I would just say the social aspect, the social skills that could be highlighted, and
correct,
specifically of those kids where they were just like born in that period, and they stayed in those 2 3 years. They have been in that period. They never went out.
yeah,
So of course that part. But then the children are the most you can mold them very easily. They are more resilient. They're more, acceptance level is very high. They are very adaptive. So
correct,
they are introduced into that situation, and then dheere dheere, slowly they
yeah,
do come up to it. So
correct,
I would not say something like, which needs to be really, really, instilled into them, but just
mm,
putting them slowly into that situation with the support is one of the best things for anyone, for that matter, even if it is a toddler, or it is of a big, like an 8 year or a 10 year
yeah,
old. So something like that will
correct,
definitely be helpful for them.
correct. Very, very important point, I think Dr. Shreya has discussed. So let's move ahead, Shreya. Uh,
Yeah, so I have a question for you.
okay, yeah.
So I have got to know that a lot of, I mean, I don't know whether it's a myth or it's a reality, but I would like to know about this because this has been playing on my mind for quite some time. That COVID has also disturbed the menstrual cycle of the women.
Yes,
Is it really true?
it is true, actually. It is true.
Hmm.
Why? Because initially there was this consensus that, everyone was getting vaccinated, or everyone,
Hmm.
in fact, then studies were conducted. And since we have data now of 2 years, it's said that, either if you get vaccinated, or even if you just get directly impacted by it, you get the virus load in your body. What happens is, virus, when it enters your body, your immune system fights up, and when the response happens, there is hormonal imbalance. And when this kind of
Okay.
hormonal imbalance happens, the pituitary gets affected, basically, and the female hormones get affected. And invariably, we know this fact now. Many medical, non-medical, everyone knows this fact that COVID-19 has been causing a lot of clotting issues, if you know
Yeah,
this,
exactly.
right?
Yeah, yeah,
Yes.
that's true.
So
Yeah.
that was the cause of many people who suffered a small TIA, or a small acute angina attack, right? So the
Hmm.
same goes for females. A lot of clotting issues started happening, and there was prolonged cycle, or people spotted a lot. So females have got irregular periods, but it's not said to be long term. Like initially
Okay.
for two
Hmm.
3 months, when there is your body is actually fighting, that virus and the load is still there partially. That happens and then it settles down. It's not like a long-term thing that always your periods will be problematic. But the prime most important thing to remember in this is it's not always that because of COVID your periods are going haywire. It's many other factors as well. Like already if you're having COVID, you're
Stress.
full of anxiety, stress, and there is a physical exhaustion. So all that is also causing hormonal imbalance in your body.
Causing.
So it's always better that you either go consult your gynecologist on it, or you get yourself a transvaginal ultrasound and get checked that no other disease in your uterus is happening. And once that is there, then you know that within 2 to 3 months of time, your cycles are going to get regular, and it's the normal response for body. Like for example, if you get malaria or if you get normal flu also, or if you over exercise, sometimes you get early periods. It's the same kind of response in your body. So that does not mean or does not suggest that, oh, all right, this is causing irregular periods. Now I'm not going to get vaccinated. No. Vaccination is a big saver. It's a big saver. You have to get it because it's going to decrease the intensity of the disease. So yes, it does. It said around 49.7% women in Indian women suffered from irregular periods after getting vaccinated.
That's like huge.
That's the statistics. I saw that this morning only. And so half the population did get affected, but still the power of vaccination is much more and important than not getting vaccinated on this. So yeah, but good question too, because there's so many patients come up to me and they said मुझे COVID हो गया था ना इसलिए मेरा cycle सब खराब हो गया, and they have a big fibroid. So it's always better to check if something else is also happening. Also, many times you're pregnant and you missed your cycle, then you feel, oh, मुझे COVID हो गया था इसलिए I missed. So no, you should always check on other things as well. And if nothing is been diagnosed, then it can be COVID.
Okay. Oh, that's like really enlightening, I would say.
All right. So, Shreya, my next question to you is, since we were talking about, children, then a major part in Indian scenario for any household comes about women, about mothers, housewives or working women. So what do you think, what is that one common finding in the women they face mentally, challenge, the mental challenge they face after COVID-19 or during the pandemic, you would say?
Okay, so, the research actually suggested that the women were much more profoundly affected than men in this and mentally because of basically, again, the increased workload, which I was also talking to you about, that they also had to juggle between the familial responsibilities and they had to juggle between their jobs and the kids, so much of the things which were going on in there. Then, if of course they did have the a support, the domestic and the emotional support of their partner or the family, then the scenarios were of course different. But if they did not have, there have been, you would have heard about a lot of cases about increased domestic violence also during this particular period. So lack of emotional support and more overburdened things, domestic violence, this increased a lot of their irritabilities and frustration and increase of depression specifically in this scenario. But there is one thing which I would like to tell you. Some women, specifically in our culture, when we talk about in India, we are not allowed to show our emotions or express our emotions very clearly. But it is okay to, express the physical things very easily. So most of it has come out in the form of the bodily or the somatic symptoms like headaches or weakness बहुत हो रहा है या body aches बहुत हो रहे हैं. So it was never considered to be as, that my irritability or my mental health is deteriorating. It is more coming out in the form of the in the form of somatic symptoms, which which is of course, one basic thing which I really think has been, has affected the women of India.
Yes, that's true. And, I feel that lack of appreciation also in Indian scenario. After all the pandemic went through and everyone said, oh, during the pandemic, the men went out, worked, and housewives were not appreciated, I feel. And that is kind of they've been building. So
I
that is one
remember of
thing
one of my
which
clients
Indian men,
here.
if you're watching today, should address and go back. Thank your women that they handle the whole family, they handle the whole house well, because that is one appreciation point you must learn from today and go back. What do you think, Shreya?
Yeah, absolutely, absolutely. And here I remember one of my clients, and she had all the bodily symptoms, and she came to see me, and that throat mein kuch hai, udhar kuch hai, and all the symptoms she used to speak. And the
Hmm.
root cause of that entire thing was an appreciation from the husband, an acknowledgement from the husband, which she was craving for, and she was already vulnerable to all this. And
Yeah.
during COVID, the thing went haywire, it was like a blast.
Hmm.
So this is I would really agree and second your point that appreciation is one of the major things which for each partner. And it's not only for men, but it is
Yeah.
equally for women. That
Correct.
it is unless and until it is said,
Yeah.
so it is not acknowledged. So
Correct.
it's good to acknowledge your partner or your family
Important to
members.
talk and acknowledge each other, men or
Exactly,
women.
each other,
Take
exactly.
home message.
Take home
Correct.
message at
All
least.
right. Let's move ahead. So, what do we have? Our next question.
So,
You want
yeah,
to go
should
ahead
I ask
with
you a
one?
question? Yeah, I'll
Yeah.
ask you one question. And we were talking about this before, as also you, because when I was talking about the health.
Yeah.
So, a lot of people, I get this question a lot as well, that, a lot of, have heard that a lot of people are getting problems after the vaccine or after the COVID, like prolonged COVID, or after the vaccine specifically, as you said, that, autoimmune disorders or heart related issues, or even for that matter, I would say clotting, things like
Yes.
that have really taken place.
Correct.
Uh, how safe is our vaccine, and what are the side effects, if there are any?
Okay.
I would like to
So,
know about that.
so a good question. We have two scenarios in this really. One is if you get impacted directly by the virus load, that is no vaccine,
Hmm.
direct COVID. All right. If you
Hmm.
have that virus in direct contact, then your body reacts obviously differently because the viral load is much higher. And
Hi.
then
Right.
the body has to fight. And like I told you earlier also, if you have a pre-existing illness
Hmm.
is not only a cancer or a cardiac disease, but illness is high obesity, high BMI.
Hmm.
All right, that also plays a very major role because what happens is the borderline diseases which you already have in your body get flared up when you have such viral load in your body, and your body is unable to fight, unable to give that immune response, and that's why all these side effects which you mentioned. So it's difficult for that kind of a body to fight. So if your fitness level is down, if your BMI is high, or if you have high cholesterol load, which you've not addressed to till now, or a cardiac disease which you are unknown of, then obviously any kind of virus does impact your immune system, and your immune system is not ready to fight it that way like it should fight in a healthy body. And that's why all these clotting issues and cardiac disorders, all these flare up when this kind of high viral load exists in your body. Vice versa, in the COVID vaccine, which at least in India, which we got, it said that outside vaccines like Pfizer, I will not name, but outside vaccines which work on mRNA don't have that kind of a severe impact because they directly impact our RNA levels. There's a DNA and an RNA in our
Yeah, they
body,
are in it, right.
RNA levels, and it goes and attached to that segment, and then you know plays the role of fighting from your immune system, and
Fighting. Hmm.
cytokines are released. But in Indian vaccine, what happens? There's a very small segment of that viral load which is released in your body, and the amount of antibodies need to be developed. They develop and they do fight. So it's in a controlled manner. The scenario is controlled. So yes, vaccination is safe. It's totally safe. It can have short-term effects, like you can have whenever you have a foreign body inside your body will fight and it will give symptoms. So having fever after vaccination is not illness. It is a
Hmm. Hmm.
symptom. It's a good sign that your
It's a
body is
good
fighting.
sign, right? Hmm.
So if you have such things, then that's okay. All right, if you have a little bit of fever, if you have a little bit of body ache, it's fine. Your body is fighting for you, and you should be happy that you're okay. You're good to fight. And sometimes, it's also said that, I didn't have any symptoms after the vaccine. Probably, I'm not getting.
It didn't work.
It can be true. Yes, it can be true. Oh. Studies have shown that people who did develop symptoms after vaccination have got higher levels of antibodies than people who didn't have. So that really depends from person to person. But what happens is, when you're taking this vaccine, you must understand what is the baseline fitness level you are at, because that will vary from person to person. For example, in pregnancy also, your immunity is already down. You're not at a higher immunity. So so the guidelines got recommended that after 3 months of your pregnancy, you get this vaccination. But yes, overall, getting a vaccination is safer than getting it directly from someone who has COVID. So there was a myth going on. That's why I'm addressing this, that, I will not get the vaccine. I already got COVID. I don't need vaccination. No. So when you get this direct viral load, you don't know how your body will react, and you might get hospitalized also. But when you get in a regulated manner this viral load from the vaccine, then your body has all the strength and immunity to fight it in a controlled manner, in a controlled environment. That's why vaccinations are safe to take and important. So those who have not got your third dose till now, go get them. And especially for children also, it's recommended. Outside, it's even recommended that anyone 5 years up should get their vaccination. In India, the protocol is a little different right now, but those who can get their children also vaccination, they should. Like I told you, babies who are born from mothers who already had COVID during pregnancy are fighters. They already have antibodies in their DNA. So nothing to worry for them, right? But the ones who are living or gone through this pandemic, who have not been affected still, it's important that you must get vaccinated. They're totally safe. So that's for that.
Thank you. That's like really great information.
So Shreya, my next question to you is, I want you as an expert, I want you to give us some tips and tricks to recover and stabilize the response of COVID-19 on our mental health. As an expert, you must tell what we can do to change our lifestyles now post this pandemic, or what we should not do, that also.
Okay. So the first and the most important thing is, like I was telling you, the way you take it, the way you are thinking about this COVID, so rather than magnifying it in your head or thinking about things that, which are not under your control. So we can only think about what is under our control, what information we can have, and then work accordingly on it. Like, we know that mask is important, so we can just do that. But we cannot stop the COVID, right? So accepting the virus and that we have to live with it also is going to build our resilience for it. So thinking correctly, in a logical way is one of the most important, because half of the people live in that fear or anxiety. That's definitely not going to help them. So focus on what is going to help you, what is going to, what is important for you, which is under your control. Then the second is, I generally, suggest to most of us, and it's just not because COVID hua hai ya nahi hua hai during this period, but generally there are 5 areas of our life where we can, always maintain our balance. And we should work towards that.
I think we've lost you, Shreya. Can you hear me? I think there's some technical glitch. She'll be right back.
Yeah, there was a glitch. Are you sure? Yeah, there was a glitch. Yeah.
Okay, we have her. Yes.
Yeah.
So we were at that, we need to maintain a balance. So let's start from there.
A balance. Yeah. So there are 5 areas of our life where we need to maintain our balance, and we need to work on it. So the first one, of course, is the health. That means we should do something or the other for our health every day. The second is the work area. We are always, if you see, we are always, mostly, most of us are just working. It could be a housewife or a housemaker who's working in the kitchen, working for the house, or it could be women or men who are working, outside the house, whatever. But it is majorly work what we are doing. Many people ignore our health. Then the third part is relationships. How much are we investing into our relationships? As simple as that, we talked about appreciation. Are we appreciating, or are we talking to our friends? The relationships, because it's not that we should be working just when we need it, but the relationships need to be maintained on daily basis, or at least on general basis. So whatever we are doing, we can do anything. Really just call your mother, or just call your friend, a long lost, you haven't talked to her, or anything small or big. Making a cup of tea only for your wife, so something like that, could be an adding to a relationship. Then the fourth aspect is, how are you enriching your life? So life enrichment on daily basis. Be learning another skill.
Shreya, audio is lost.
Hello.
Yes, we have you back. Yes.
Hello.
Audio got lost.
Yeah. So
I can hear you.
How? Okay. You can hear me now. Okay. So the life enrichment basically means you can just start and learn any kind of a skill what you want to. It could be, anything. If you like to sing, you can sing. If you want to learn some life skill, you can learn a life skill. You can do anything. You want to learn photography, you can learn photography. You can do anything, anything what you choose to, which makes you happy, which makes you purposeful, which increases your value, basically. And the last is, like what we call pleasure time, leisure time, where we need to rest, we need to take. And of course, this does not mean just screen time, because these days leisure is only equivalent to, binge watching Netflix or social media. No. Yeah. So it could be anything. It could be, you can take up gardening, you can take up anything. Yes. So my main focus always here is to do, if you see, they're all 5 areas, but they're all actions, they're all behaviors. So we need to put in something to, to maintain that balance in your life. And if you see that, if in 1 month, if you do if you tick mark that I have done all these 5 things in your day, you will see generally you will be much more happier. Correct. The main big purpose here is because we do not want to put all the eggs in one basket. कि अगर वो एक बास्केट गिल गई तो वो सब हम डिप्रेशन में आ जाते हैं, हम we get into anxiety etc. But if अगर वर्क में कुछ प्रॉब्लम आया, we have other 4 areas to at least fall back upon. So that is what is very important to maintain our balance.
So true. Then, so true. Yes, go ahead.
Yeah. So, and of course, during the COVID and after the COVID, I always used to maintain the fact that, building a routine is one of the basic things what we can do to make our life purposeful. Because if we have a routine, we have some kind of a purpose. Right. And if supposedly you are not doing it right now, then go slow on it. Just one by one, step by step. Because sometimes it becomes overwhelming also that, oh my God, itna sara kuch karna hai. So if you're not doing anything, maybe one step ahead can be the best thing. You do not have to beat yourself up कि मैंने इतना सब कुछ नहीं किया है. Correct. And one of the most important things in our Indian culture, which I have found, which I would really make a point here, we do it with our kids also. So हम कहते हैं कि रेस्ट बाद में करना, कोई वो सब चीजें बाद में करना, पहले काम कर. So it is as if the rest is earned, but rest is not earned. We must listen to our body. Specifically when people are recovering from COVID or suffering from COVID, rest is very important. So rest, listen to what your body is saying, listen to what your feelings are, listen to what your bodily symptoms are saying. So that is the time when you need to rest. Stop if your body says stop. So
health is wealth. Yeah.
Yes, absolutely. Health is wealth. And if you are not able to handle anything, then see a professional. So that is how you can actually, manage yourself post-COVID, or in any case, in any scenario, I would say this is common for anything.
Yes.
Especially.
So true. I feel these are such important words you said, and so true. If you can just chart out your life like that, and if you know, the start is from where you know that you can do this for
This,
yourself, because if you can
correct.
keep yourself happy, you can keep others happy around you, right? So
Exactly.
in COVID personal experience, I would like to say I live in a joint family, but being a doctor, I really didn't get a pause. But from my non-medical friends, I realized that that pause was such a boon to them, because they not only realized that they bonded with their family or their children in another level, because once we are, having the same monotonous life, that they go to school, they come back, the husbands go to work, they come back, you don't get that kind of bonding or talking and appreciation levels. No, nothing. So, but during COVID, one positive thing which happened for many who utilized it to the fullest was that their family bonding increased, their me time increased, they got opportunity to do things for themselves as well, and many of them constructed it in a productive way. So being during that pandemic or after that pandemic doesn't matter, like you said. It is the art is in maintaining that balance. And
Correct.
if we know that art, we are good to go. And if we don't, then and we feel that we're unable to cope up to it, then definitely there shouldn't be any hesitation to ask for help. I think that is the biggest giveaway today, that you can learn that there is no hesitation. There shouldn't be any hesitation. There shouldn't be a taboo, especially in Indian scenario, that oh my God, I'm consulting a psychiatrist or a psychologist, and I'm suffering from depression, and I don't want people to know, otherwise they'll judge me. It shouldn't be like that, because this you're doing for yourself and for the people around you. So
Yeah, absolutely, absolutely. Is this that's like the key point. You're doing it for yourself, but you're also doing it for others,
correct.
because the others have to then take care of you, which would
Yes.
again be a little sometimes in the families it's not very I would say called for,
Yeah.
specifically in Indian. So do it for yourself. That's very important.
So physically also,
So
I feel still actually the endemic is going on. If you would not say pandemic, but endemic is still on for
hmm,
COVID-19. And there are some take home points I would also like to give. That first
yeah,
and
please.
foremost, that those who are still not vaccinated and they feel they've suffered this virus and they have antibodies. You must understand this, that the antibodies last for a certain period. For example, the study suggests that for 3 months to 4 months maximum, these antibodies persist in your body. Your immune system fights, they produce antibodies. But over the period of time, they do get exhausted. So why this vaccination? Why do you need this vaccination? Is because you keep developing, you keep having these antibodies, that if this COVID-19 hits your body, then you have severity levels of 1 or 2, not 9 or 10. That means you don't need hospitalization if the viral load is not high, if you are vaccinated. But vaccination does not mean you will never get COVID. That is also one very big myth which flows around in India, that now I'm vaccinated, I can be mask free. No, because vaccination does not mean that you will not have COVID-19. You can suffer from
Hmm.
COVID-19 as a normal flu, and you will not know if you don't get tested. All right, but you will not be required to get hospitalized. The severity level will be much less if you already have antibodies of the same. So even especially in metropolitans, the pandemic is on the rising trend these days, and there are some points which you must remember, that if you are in a traveling crowded place or in an enclosed area, you must resort to using a mask. All right, N95 is not a must. Even if you have a good tight 3-ply mask, that's enough. Try that once you're back home, you can sanitize your hands. You can wash your hands for a good 30 to 40 seconds with soap. That's also more than enough. And these are the two basic points, because I feel even before the vaccination had come, mask was the biggest strength for at least the
Strength.
doctors. We had survived COVID-19 without getting struck by it, just on the basis of masks. So if you are in a good mask, in wearing it in a proper way, I don't think this disease will affect you that much. And believe me, the ones who have been affected, like Dr. Shreya said, have suffered, a lot, not only physically but mentally also, because it's not just suffering through COVID-19, but it's the isolation of this disease, which, initially in the first and second wave, everyone suffered. When you were
Hmm.
isolated from your entire family and kids, that was a major breakthrough for many, because then they realize what's the importance of, having loved ones near you or caring for you. Many people,
Hmm.
I have heard stories that, many elderlies who didn't make it through this wave, didn't even get cremation ceremonies. It went to that
Correct.
level also in India.
Level.
And we must remember that, the importance of mental health well-being is very, very important. Why? Because we must learn through this pandemic that the balance, maintaining balance, is as important. And maintaining this balance, and appreciating the people who love you around you, and talking to them, not leaving anyone isolated, making relations, bonding, and balancing the entire 5 points which Dr. Shreya has mentioned today is immense and very, very important, and will result in a healthier mental life in the coming years as well. What do you think, Dr. Shreya?
Absolutely, absolutely. So well put. I would say you've actually summarized the entire session, and you added such great points regarding the elderly and how communicating with them and the family, bonding, everything is so important. And you cannot substitute anything with that. And this emotional support, the support from outside, is one of our biggest strengths if we can use it. So, as such, and this I think we all have realized specifically during the COVID times. So, I hope we can maintain that balance and work towards that, and not get into the same previous rut as we were talking about the other day.
And
So,
also, I would just last I would also like to mention about the mothers, that communication not only to your spouses is important, not to your family, but your children
kids,
also is important.
right?
And we must not underestimate our children by not talking and telling them the facts, what's happening around in the
Hmm.
world. But we must try to communicate. What do you think, Dr. Shea? I
Hmm.
think
Yeah,
is
absolutely.
a major milestone for children. They do understand, they are very young, but they do understand the,
Hmm.
the importance, the emotional attachment, the communication, and they feel that, all right, that they are being trusted upon by their parents, and the bonding will get stronger, and they will communicate easier in the coming years with you. What do you think, Dr. Shah?
Yes, absolutely. Because I still remember, when you were talking about this, I had one line stuck in my mind, which my daughter told me during this pandemic time. She actually told me that, it looks like I'm in a prison. I
Yeah,
mean, to that level, they were experiencing that social isolation. And she is an extrovert. She wants to go out and play and be with others. And that's what, they stifled here in just the house. It was so difficult for these kids, and they observe a lot, they see a
yes,
lot. and
yes.
and I remember when we were all suffering from this COVID,
Mhm.
because when we got hit, so she was outside, and it was so disturbing for them. So these kids, and what they see, they observe so much. So I would say, listening to them, just not talking, but listening to them, what they have to say. They
Mhm.
would say such big things, which would be, like, you would be shocked that, okay, this is
Correct,
what they are feeling. So
correct.
that has to get out, and they need to talk and tell us what they are feeling. This is one of the most important things what I would suggest for the parents to do with the kids, especially.
Correct. So I think some very useful tips we've given out today, and everyone will thank us later. I hope so. And I hope that we have answered all the queries which we got in our questionnaire. So I think we'll wind up on this note, Dr. Shreya.
Yeah, absolutely. And thank you once again to all the audience who had joined us, and especially to you, Dr. Soumya. It was a pleasure being here and, talking to you.
It was likewise, and thank you so much for spending so much time and giving us such valuable points. I'm sure the audience is thrilled and is going to implement at least some points which you've given them today. And I think one tea is going to come for the women in the night from the husbands. What do you think?
I hope so. I hope so. I hope my own husband is watching this.
All right. So on that light note, I'm going to end this. So I'm going to see you soon again next month in another session of Cura Talks. Thank you, Dr. Shreya, for being a part of this. It was lovely having you. Thank you, everyone.
Same here. Thank you. Bye-bye. Take care.
Bye-bye. Bye.